One of the big challenges for me was that I trained as a physician. It's interesting when you're listening to you sort of talk about the idea of always knowing what your path was. In some ways, when you're a physician, you have to know what your path is because you go to medical school. You have to finish your pre-med requirements. It's a pretty prescripted path. But what I think I learned along the way was that there's still a lot of choices within that path that one can make. Do you become a surgeon or a pediatrician, an obstetrician, or an internal medicine doctor? Do you do what I did? You take 2 years off before you go to medical school. You work on a ranch and for a photographer, taking pictures of pets with Santa Claus at Christmas, and then buy your one-way ticket around the world and travel for $5 a day and really discover how the world lives, which was a very life-changing moment for me before I went to medical school. I took 6 years to go through medical school, which someone tried to tell me was the remedial path, and I almost punched them in the face, but that's a story for another time. And I did that because life happened. My mother got sick. Many of you probably know this already. My father is John Kerry and Secretary of State, and he ran for president in 2004, and that was a life-changing moment that I wanted to be a part of and certainly had a huge influence on me. I decided to go get a master's in public health. And so the journey does zigzag as you go along. And I think that, so for me, the challenge was realizing I was a physician and deciding that I wanted to start an organization that was going to be about social change. I realized I actually was starting a business. And I shouldn't say I had no idea. I have no idea how to run a business. And it's been very humbling for me to understand, because as a doctor, you really want to be in control. I want to promise you as my patient, I am in control and I know what's happening. And when you are starting a business, that is not the case at all. And you are really trying to rely on other people to help guide you. And so that's been a huge challenge to sort of learn trying to identify that I don't know what I don't know, and making sure that I have the partners in place to help me recognize that you really don't know this, and so that we can build that. The other really realistic challenge that I've had, and it's going to at first sound like nobody else would have this challenge, but hear me out for a second, is that by being the daughter of a prominent person, a lot of people assume that I have connections. A lot of people assume that things have happened for me. And don't get me wrong, I am grateful for the opportunities I've had in my life, and I'm not going to pretend that I've had a hard knock life in any way, shape, or form. But I do want to say that it presents a different kind of challenge, because it's also been really critically important that this work, especially because it's government funded, got created entirely independently. And that meant that I couldn't talk to my father about anything I did. I couldn't share with him what I was doing, and I certainly wasn't going to let him help me, which is, I think, very difficult for him too. As a father, you want to help your kid. And so he would get very frustrated, but he didn't really know anything. And just as a side note, when he was getting vetted for Secretary of State, he called me up laughing and he goes, "Guess what I got to ask today?" And I said, "Oh, if you knew anything about Seed Global Health." And he started laughing. I go, "Yeah." And he goes, "And guess what I got to say?" And I, of course, used an expletive, but you knew blanking nothing. And he started laughing. He goes, "Exactly." But it was sort of a proud moment for us both, because I had created this program that was now a internationally recognized nonprofit that has been called by the President of Malawi as the missing link of healthcare delivery. Not because I relied on any help, but because was thoughtful with my friends and partners and colleagues about what needed to happen. We learned about why this had never happened before, despite the clear need. We looked at the times that people tried to start it, and we looked at why it failed, and we figured out how to design this in a way that it wouldn't fail this time, and it filled some of those niches. And most importantly, we just hit the grindstone and looked for every opportunity to make this happen. And the reason this program came into existence is because we went to a public forum with 3 former Peace Corps directors and the then current director. And we asked anonymously, we stood up, we raised our hand, and we said, "What do you think about the Peace Corps sending doctors and nurses abroad to be medical and nursing educators, providing technical capacity, and really living out President Kennedy's original vision?" These people didn't know who we were from a hole in the wall, and they said, "It's a great idea." I don't think they counted on us elbowing our way to the front of the room saying, "Hey, great, here's our card. When do we come to DC and talk about it?" But that actually is the moment that Seed Global Health got created. And it happened not because of connections. And this is where I'm saying the story is relevant to everyone, but it happened because we just learned everything we could. We looked for the opportunity and we decided that we were going to find a way in a strategic and thoughtful way to implement change. And then we just went about knocking on doors and finding the opportunities until it resonated with someone. And I think that that was a really important message for us, that, you know, there is always a path forward. It may not always be clear, but if you put your, you know, you really know the environment in which you're working and what has failed and not worked before, it gives you the courage to take the chance to find a path forward that no one's tried. And you may fail, but then you kind of bump, you reroute, and you go back. So all this is to say that the zigzags are worth it, and that, you know, that there is opportunity there. And sometimes it just takes a lot of scrambling to find, you know, to thread that needle, but it's there.